Does minimally invasive surgery cost more?
Another misconception that parents may have is that the cost of laparoscopic surgery is higher than open surgery. So we break down the different components of the cost of a surgical journey, that is the pre-operation consult, the operation itself, the recovery in the hospital, and also the post-operative visits. We need to look at where the costs lie. So if you look at the pre-operative consult, the cost between open and laparoscopic surgery is identical. In terms of the operative surgery point of view, the cost may be slightly higher. But in terms of the operative recovery, if the child needs to stay a few more days, this is where the cost benefit arises, whereby with the laparoscopic surgery, the duration of stay is fewer versus the open surgery. And finally, the follow-up and the consults may require fewer consults because the outcomes and the recovery is faster. So let's look at the day surgery, for example, for inguinal hernia repair. The cost overall may be higher because there is no post-operative stay. So for day procedures, the overall cost for laparoscopic surgery is higher. However, the trade-off is that the child recovers faster. The collateral damage and the scarring is much better for the laparoscopic surgery. However, for children who've had complex surgery whereby they need to stay in hospital, the duration of stay is shorter, and therefore the trade-off of doing laparoscopic surgery is much more beneficial in this situation.